Medical student syndrome, MSS, is a phenomenon commonly experienced by medical students who, upon studying various diseases, begin to fear they have these conditions themselves. Here's a review of MSS, covering its characteristics, potential causes, and ways to manage it. 1. Characteristics of medical student syndrome definition. Medical student syndrome is a form of health anxiety characterized by heightened self-awareness and concern over potential illness. Students may misinterpret normal bodily sensations as signs of severe disease. Symptoms. Symptoms vary but typically include anxiety, hypervigilance about one's health, and frequent self-diagnosing. Physical symptoms can also appear as a result of psychosomatic responses to stress and anxiety. Prevalence. Research suggests that a significant number of medical students experience MSS to some degree, especially in the early years of medical training. 2. Potential causes and contributing factors. Intense exposure to medical knowledge. The constant exposure to a wide range of diseases and symptoms can lead students to focus excessively on their own health. Stress and workload. The demanding nature of medical school often contributes to higher levels of stress, which can manifest as physical symptoms and amplify health-related concerns. Confirmation bias. When students learn about diseases, they may over-focus on personal signs that fit the description of the conditions they are studying, leading to a cycle of self-confirming worries. Psychosomatic response. Anxiety about illness can lead to actual physical symptoms that reinforce the belief of being sick. 3. Psychological perspectives on MSS. MSS is viewed as an example of health-related anxiety. In some students, it can lead to temporary hypochondriacal behavior, though this usually resolves over time. Certain psychological theories, like cognitive behavioral models, suggest that anxiety arises from misinterpretation of bodily signals and catastrophizing thoughts about health. 4. Differential diagnosis and when to seek help. MSS should be distinguished from clinical hypochondriasis or illness anxiety disorder, where the individual's concerns are more persistent and disruptive. If a medical student's anxiety persists or affects their academic and personal life, counseling and psychological support may be beneficial. 5. Management and coping strategies. Awareness and reassurance. Recognizing MSS as a common experience can provide reassurance. Faculty and mentors should also address MSS as part of medical education. Stress management, mindfulness, meditation, and physical activity can help reduce stress and anxiety. Cognitive behavioral techniques. Techniques to challenge catastrophic thinking and focus on rational interpretations of bodily sensations may be effective. Seeking support. Engaging in peer support groups or seeking advice from senior medical students can provide relief and perspective. 6. Conclusion. Medical student syndrome is a widely recognized phenomenon that highlights the impact of medical training on students' mental health. With awareness and coping strategies, students can manage their anxiety effectively.